Welcome to the Quebec Academy of Aesthetic Medicine in Montreal. There is a well-documented gap in aesthetic medical training between passing a foundational course and treating patients independently. The standard educational trajectory works exactly as designed. You complete the theory modules, you pass the group practicum, and you receive your certificate. The friction occurs when you return to your own clinic. A real patient sits in front of you. You are suddenly making independent dosing and anatomical decisions without a clinical supervisor in the room, and the confidence you expected to feel is absent. This lack of confidence is not a failure of your foundational knowledge. It is simply a lack of supervised repetition. To resolve this specific deficit, AMEQ Academy developed its aesthetic shadowing training, operating in Montreal and Saint-Sylvain. This program is strict in its audience. It is precision development for working practitioners who are already licensed and hold foundational hands-on experience. It is not an introductory course for beginners. Closing the clinical gap requires an environment where high-volume repetition meets real-time expert oversight. Standard medical shadowing places the junior practitioner in a passive role, observing a senior clinician work on the senior's own patients. AMEQ inverts this model entirely. You do not observe. You are the primary injector. As you inject, a senior clinical nurse supervisor maintains continuous, direct scrutiny, correcting your mechanics and angles throughout the entire procedure. Active injection under direct scrutiny bypasses passive learning and immediately translates to autonomous clinical confidence. The logistical structure of the mentorship is highly concentrated. You are given one full day, and you are the only student in the room. There is no preset curriculum and no rigid, predefined syllabus to follow. The agenda is dictated entirely by your specific technique gaps and the specific procedures where you need to build clinical certainty. Sessions are booked individually, typically on Wednesdays, Thursdays, or Fridays. Availability is limited, making early contact necessary to secure your practical date. To participate, you must hold a current Quebec healthcare license and have existing foundational hands-on experience. The logistical framework is designed entirely around eliminating your specific clinical blind spots without the constraints of a generalized syllabus. This clinical focus panel details the first highly customizable area, neuromodulators. In this module, you refine the variables that produce inconsistent outcomes in independent practice: injection depth, unit distribution, anatomical landmark selection, and patient-specific dosing decisions. You practice specific facial treatment patterns, including the upper and lower face, the masseter, or corrective approaches for asymmetry. Moving to this breakdown of hyaluronic acid filler training, the focus is divided between standard and advanced anatomical placements. Treating standard zones like the lips, nasolabial folds, and jawline allows you to build injection rhythm and improve volume distribution. Advanced filler zones, including the mid-face and temple, require a significantly higher level of anatomical awareness. This cross-sectional map of the temple region highlights the specific, meaningful vascular risk associated with filler placement in this area. Under direct supervision, you execute the real-time decision-making process for needle versus cannula flexion, tissue layering approaches, and post-injection assessment. Safely migrating from basic volume distribution to advanced high-risk anatomical placements is only possible through immediate expert clinical correction. Cannula technique represents one of the most critical mechanical gaps for injectors who trained primarily with needles. You work directly on entry point planning relative to the target zone and the underlying facial anatomy. You learn the complex mechanics of tissue plane navigation and precise depth calibration. You learn to manage the physical tissue resistance, dynamically adjusting the approach and pressure of your cannula in real time. This supervised protocol outlines the final available focus area, platelet-rich plasma, or PRP. This covers the complete clinical workflow: preparation, the centrifugation protocol, precise injection technique, and post-treatment assessment. Theoretical knowledge of PRP is insufficient. You need supervised live patient fluency before attempting it independently. Mastering these specific mechanical modalities is what separates a merely capable injector from a confident, fully independent practitioner. The group setting dilutes individual repetition and inserts a passive observational filter between the student and the instructor. private one-on-one supervision removes that filter, allowing for unlimited individual repetition. You receive corrective feedback at every single needle placement or cannula pass, rather than waiting for a debrief at the end of the day. Instantaneous feedback, devoid of the group filter, is the only educational mechanism that produces permanent, lasting technique change. This alignment overview details the strict regulatory frameworks required to practice aesthetic medicine in Quebec. For physicians, this mentorship fulfills the Collège des médecins du Québec guidance, requiring appropriate training prior to adding aesthetic procedures. For nurses, it reflects OIIQ requirements. Care is delivered under a prior evaluation and individual order, with a qualified clinical supervisor present throughout the entire session. For dentists, the program provides focused anatomical coaching well within the ODQ framework. AMEQ's clinical environment is explicitly structured to comply with all provincial professional development expectations. To register, practitioners can contact AMEQ Academy directly at education@clinicag.ca or by phone.